Good evening. It's Rob Chappell, executive editor of Madison365, with your daily update in the evening edition of the daily update, because it is Wisconsin Leadership Summit this week, which takes up all of our days, and that wraps up late afternoon, and then a whole bunch of other stuff to take care of. So I'm here in the evening to give you an update on the COVID situation in Wisconsin, as well as some local news. But first, the Wisconsin Leadership Summit is happening this week, as I mentioned. We've had 2 days so far. We've got 3 days to go. It's still open. You can still register at wisconsinleadershipsummit.com. Today was all about education. Tomorrow is all about social justice. And I have to mention that one of the sponsors of the Wisconsin Leadership Summit is American Players Theater. Their new adaptation of Oedipus, featuring Gavin Lawrence, who you see here, has closed, but you can still see it. APT received an extension for the APT at Home professionally filmed version of the play. You can watch it at home through October 24th. You got to pay for it, though. The tickets and information are at AmericanPlayers.org. AmericanPlayers.org. And the Wisconsin Leadership Summit is sponsored by National Guardian Life Insurance. For more than 100 years, National Guardian Life Insurance Company has proudly served policyholders through connection, collaboration, and compassion, specializing in a suite of innovative insurance products for life's journey. NGL helps people face their financial challenges with confidence, dignity, and grace. Learn more at NGLIC.com. And we appreciate their support of the Wisconsin Leadership Summit. It's with those sponsors that we're able to create unique events for the state of Wisconsin. Now let's talk COVID for a minute, because the news is good. I mean, there's no other way to say it. I mean, I've been honest with you when the news is bad, and I'm going to be honest with you when the news is good. A lot of outlets, as you may have noticed, there's an incentive to report bad news or to make even good news sound as scary as possible. And I understand that incentive because, frankly, when the news is bad, I have more people watching this update. Right? We're a nonprofit news outlet. We're not interested in the pure number of eyeballs, whatever, the way some other outlets have to be. So I'm going to tell you when the news is good, I'm going to be honest about that and tell you the news is good. I don't want to get complacent. Okay. I'm not ready to say like, okay, everybody, it's over. You can go to Thanksgiving without a mask on. You know what I mean? I'm not quite there yet. But the new confirmed cases on average per day is below 2,000 for the first time since early September. No, I'm sorry, late August. Yeah, the end of August, it was like 1,700 a day. Now today it's 1,977. That has been on a precipitous downward trajectory for the past week. The percentage of positive tests is also down to 7.6%. That's still really, really high, right? You don't have this virus under control until you're below 3% on the positive test rate. We're at 7.6 right now. So that's bad, but that was 7.9 yesterday. It was 8.2 last week, right? Downward trends are what we want to see. Even the death average is down, which surprised me a little bit, just because of the lagging nature of deaths as an indicator. Usually, when cases go up, deaths go up like a month later, and conversely, when cases come down, deaths come down a month later. But the deaths are down today. Again, these are just deaths reported, not that actually happened, right? These are deaths that happened probably a month ago, but we're down to 11 per day to being reported now. Only 15 reported yesterday. That's still a lot, right? 15 people dying in a day is a lot. But again, it's an improvement, right? Hospitalization, similarly, actually pretty level from yesterday. 9 more people hospitalized. It's now 1,090. But that's 100 fewer than a week ago, right? So even though it's up a little bit for the day, it's down a lot over the past week. 308 people currently hospitalized in ICUs. So that's basically the COVID numbers. We still want to see. Vaccines increasing. Kate, this is actually, Kate's got a good comment here. I don't think people are testing. You know, a lot of people with COVID. caution against personal experience as data, right? Because that's the way social networks work. If one person in your network has COVID, chances are that more people will, because they're like, your network is all kind of like touching each other, right? Not literally touching each other, but that's also the argument against all the mandates and everything. Early on, I was like, I don't know anybody with COVID. Okay, you don't know anybody with COVID. It doesn't mean COVID doesn't exist. Now, we do still have a lot of cases, right? I don't want to. I believe you that you know a lot of people with COVID. I know people with COVID right now. I know people who've tested positive recently. Almost 2,000 cases a day is still a lot, right? Like, I don't want to minimize that. But the fact is that it's going down. Now, on the testing point, that's a really interesting thing, because we don't have the big community testing sites open. However, this really surprised me when I learned this like a month ago, that actually we're doing almost as many tests per day now as we were a year ago, when all the big testing sites were open. Here's why. The big testing sites, even with the 3 and 4 hour wait times, were not actually doing that many tests. They were doing a few thousand a day, which is, that's a lot. Like, they were doing 3,000, 4,000, 5,000 a day. Whereas the surveillance testing in the healthcare profession is doing 30,000 a day. Right? So the people who are tested on a daily or like every other day basis, healthcare workers, teachers, law enforcement, all the sort of public facing assisted living workers, prison guards, inmates who are getting tested really regularly, those are 30,000 tests a day, give or take. So we went from a year ago to like 35,000 tests a day, now to 30,000 tests a day, right? Slight decrease, but not very much. We're still testing a lot of people every day, which is why that 7.6% is still concerning. Right? With that many tests, we should be seeing 2 or 3% be positive, and we're at 7.5%, which is still too high, but it's lower than it has been. Its trajectory is downward, right? So, but I also think you were right about this. That people are doing home tests. That if everybody who did a home test, we've done like 3 or 4 home tests in our household, and they were all negative. So then we did not take the next step to go get officially tested, right? So last year, that would have been like 3 or 4 extra negative tests in the mix. Now, is that happening in sufficient number to really affect the statistics? I doubt it. You'd have to have 10,000 people every day doing that to make a meaningful impact on the statistics statewide. There's not no effect, but I don't know that it's enough of an effect to really change the epidemiological statewide statistics. Also, home tests are not particularly accessible. They should be. They should be handing them out free on street corners. But they're not. They're like $20 for 2 of them. And Walgreens is out of them most of the time. This is, you know what, Kate, this actually makes sense. That if you're in a low vaccinated part of the state, because the state as a whole is vaccinated less than the country as a whole. The country is like 70% vaccinated already. Wisconsin's 54.7%. But there's difference within the state, right? Dane County is like 70 something percent, whereas like Pepin County is like 30%. So that can affect your personal experience, right? I mean, this disease it's a virus, so it travels, but it ends up being kind of regional. There are these regional pockets, because that's how it works. That's how viruses work. That's how social networks work. That's how people work, right? So if you're in a particularly low vaccinated area, it's not surprising that you would know more people with COVID than I do, because I'm in Dane County, where pretty much everybody's vaccinated, and by the way, everybody's wearing masks all the time. So that does make sense. And I didn't mean to suggest that you were wrong about that. You know your experience. You know who you know. But we're still seeing 2,000 cases every day, most of them in those areas where you're getting, 130, 140 cases per 1,000 people still because of those low vaccination rates in those communities. So, and where it's hitting hard right now is those rural areas. That's still where it's at. So anyway, thank you for watching, Kate. Thank you for the questions. Thank you for the comments. I appreciate the interaction. That's what I love about doing this. This is why I do this live, right? I could record this and put it up, but then I would be able to talk with you and answer your questions. I love that. So thank you for that, Kate. We're going to take a short pause, and we'll be right back. And I've got a couple more news items for you. Nothing too drastic, but a couple of news items you might be interested in. So we will be back with that right after this. All right. It is on the website today at Madison365.org. We have a feature. This is from this morning, but it's still on the front page. That there's a nonprofit in Madison called Affordable Dental Care, and if you don't know, dental care is very important. Okay, I'm going to say that right away. As someone who's had I'll tell you the story sometime if you want to, but I literally nearly died because of an infected tooth, right? And for some reason in this country, we separate dental care from healthcare because your teeth are like a separate system or something. But if you don't have access to good quality dental care and you can't afford it because it's very expensive, it can cause significant education problems because if you're in pain, you can't concentrate. It can cause all sorts of health problems. So there's a nonprofit in Madison called Affordable Dental Care that helps folks who either don't have insurance or can't access government programs or whatever. And they have a new executive director. Her name is Aurelia Estrada. She's been in Madison a while. She spoke with our reporter, Angelica Usuri, about her new role, about where she comes from in Mexico via Los Angeles, and about her goals for the organization, as well as the challenges that the organization faces. They also have a fundraiser coming up on November 14th. Their Smile-a-thon run is coming up November 14th. And if you want to help support this organization, there's a link there to help out. And it's again, that story is on Madison365.org. And one bit of national news today, the University of North Carolina may continue to use race in its admissions criteria, according to the ruling of a federal judge on yesterday. This comes from a lawsuit filed in 2014 by the group Students for Fair Admissions, which argued that University of North Carolina used race in its admissions process and that it intentionally discriminated against certain members based on the race and other factors. The federal court ruled, that was not discriminatory, and that is allowed to continue. A lot of people like to claim reverse racism in things like affirmative action, and that's just it's usually not the case, according to the court. So that's all I have for you tonight. I appreciate your being with me at this late hour. Again, the Wisconsin Leadership Summit is still happening tomorrow and the rest of the week. Frankly, you can still get in on it. WisconsinLeadershipSummit.com if you want to. I appreciate your attention. Have a wonderful evening, and we'll see you again tomorrow.
This is 365 Media.